Good afternoon, everybody. For decades now, we have seen overwhelming evidence of the interrelationship between oral and overall health. But we're stuck. And where we're stuck is in implementing this science. And in fact, I'm going to suggest today that the science no longer supports the traditional role of a dentist and dental hygienist being confined to the oral cavity. So today, I'm going to challenge you to embrace a new model of care, and that is the non-physician primary care provider. That has been authoritatively defined as a health care provider other than a physician who renders primary care services. And guess what, folks? That's you and I. As oral health care providers, we are uniquely positioned to render primary care services in the dental settings. The truth is, I haven't always gotten this stuff right. But I'd like to share with you one of many pivotal experiences that has sort of shaped my thinking on this. Her name was Betsy, this beautiful 68-year-old woman who I was seeing for the first time. And as I was probing her mouth, I noticed the alligator tears. And I thought, oh, geez, here we go. What did I do? And so I stopped, and I asked her if I was hurting her. And her answer was, no, Casey, you're not hurting me. I'm just so upset that until today, no one told me about this link between diabetes and gum disease. And who knows, had my gum disease been treated properly, maybe my blood sugar levels wouldn't have been bouncing all over the place the last 15 years. And in fact, Betsy had routinely seen an endocrinologist because of the difficulty in managing her glycemic control. So at the time I saw her, she presented with advanced periodontitis and an HbA1c of 9.5, which is high, very high. So after conferring with her endocrinologist, we referred her to a periodontist who did non-surgical periodontal therapy. And guess what? Within 2 months, her HbA1c dropped to a healthy level. Well, that's great news, right? And I hallelujah. Unfortunately, we can't say that for sure that periodontal treatment really made that impact, but I think it did. But unfortunately, she also suffered from the cumulative complications of diabetes for so many years. And 6 months later, we lost Betsy to a massive heart attack. So we have to ask ourselves, if her previous healthcare providers, oral healthcare providers, had practiced more as primary care providers and connected the dots between her periodontal disease and diabetes, could we have improved that outcome for Betsy? And the answer resoundingly is yes, I believe so. So tomorrow, you may very well have a patient just like Betsy, or maybe 2. And there are 4 recommendations I'd like to share with you that are all evidence-based. Number 1, perform a thorough and comprehensive periodontal evaluation routinely on patients who have diabetes, prediabetes, and those who have risk factors for diabetes. Number 2, early. Diagnose and treat as early as possible. This may mitigate complications of diabetes downstream. Number 3, monitor blood sugar levels against periodontal parameters and pay particular attention to bleeding upon probing, as that's indicative of inflammation. And finally, number 4, educate. And of course, we're going to educate our patients. But there's another group I want you to reach out to, and that's the diabetes healthcare team, physicians, diabetes educators, and nurses, to help them connect the dots. And don't be bashful about asking for a direct referral. Ladies and gentlemen, dear colleagues, I think early adopters of this model of care are going to be the big winners. They will have more patients who are more willing to invest in their oral health and more apt to refer their friends. I believe that they will be the recipients of direct referrals from the medical community, and they will enjoy rich collaborative relationships. And I believe, so if there was ever a time for bold progressive dentists and dental hygienists, that time is now, because we're entering an era of integrated medical dental delivery systems, and that era will be powered by excellent clinicians just like you, and clinicians who are willing to look beyond the tonsils and redefine themselves within the healing arts as primary care providers. This is the way we can help people that are so dear, like Betsy. Thank you.
Wonderful. Let's give Casey Hein a hand.